So how's it going, guys? So we have an international patient flew all from Nepal. So let's see, and there's a significant language barrier over here. So in essence, he complained about low back pain, and if he stands or sits too long, then it becomes left sciatica. There's left numbness all the way down to the foot. Correct?
Yes.
All right. And he also mentioned about when he puts pressure over here, then that's when he's able to finally burp.
Yes.
Right? And otherwise can't burp at all.
Yes.
Right? And it feels a lot of pressure over here as well.
Yes.
Right? And then the past week, you start to experience sleep apnea, where he just had a lot of trouble breathing at nighttime. Looking for abnormal temperature, and we're finding one right at this level as well. Stuck. Right. So we got an abnormal movement right over here. Swelling right here. So another swelling right here. And we check for abnormal motion over here. Yeah, right here, that's stuck. Some edema, but not too bad. Abnormally stuck right here. And we saw some abnormal swelling, tissue swelling right over here. Muscles tight over here on this side as well. Check for abnormal motion. And yep, it's not moving whatsoever here. It's stuck. All right. So, we already identified this nerve as a problem. The nerve goes all the way straight down to here. Right? So, identify that can help duplicate what you're experiencing right now. We also found one right over here, here, and here. This one is important in your case because you try to burp, right? The problem is we have two gates for the stomach. One over here, one over here. We need proper nerve function to get these gates to properly close and open when they're supposed to be doing. So as we see over here, these nerves, they're connected straight over to there. So when we start to have a structure that's knocked out of alignment and puts pressure on that nerve, the gates on both ends of these of the stomach doesn't function as well as they should. So we can have a buildup of gas in the bowels and have that trouble burping. Right? So we need to restore the nerve function for that one. In terms of your sleep apnea, usually what happens is this. Where are you hiding? Okay. These two areas over here, right? This one over here is actually some foundational support for your neck. And this one over here deals with the trigeminal nerve. So the trigeminal nerve itself, if it doesn't operate the nerve to the top part of the soft palate, palate collapses, and then your tongue also sinks back in your back to your throat. So that's what makes you snore. It makes you hard to breathe. So we need to restore these two as well. X-ray confirmed that there is a lot of structural damage with this disc over here. It should be a nice, beautiful rectangle shape like this, but no. You see a little bone spur here, spur over there. And this disc, it's shrunk in half. Normal, I want to see this. You have this. Half the size. This is what we need to correct first. And then this for your stomach. This one over here for the sleep apnea. And this one also for the sleep apnea of the throat. It also helps a little more with the burping as well. Yeah. What up? Jeez.
He snores a little less now.
A little less.
Yeah.
So how's the gas?
Gas,
to definitely changes. Now it's okay.
Now it's got better?
Yeah, better.
Good.
There's a piece. A little more.
That was it. So for the final visit, give us an update. How's he doing with his gas?
Better,
It's
better
better.
than before. No.
Excellent, great.
Yeah,
And how's the sleep apnea?
It's,
Well, better.
it's better.
Good.
Yeah.
All right. So what's left over?
अब के छ बाइक चाहिँ दुख्ने
छैन, nothing.
बाइक उठ्दाखेरि पछाडि दुख्ने छैन
It's not bad problem.
छैन अहिले उठ्दाखेरि दुख्ने धेरै
It's good.
He's saying last time we went to Niagara Falls, he stood up for maybe 4 hours. So, you know, he was.
Hey, that's great progress.
Yeah.
Standing for 4 hours.
Yeah.
That's
Yeah.
very, very great progress.
He was standing for 4 hours and then.
All right.
Healthy. You know.
Well, I'm glad to hear.
Yeah.
All right. So you have a safe trip back to Nepal. All right.
Get it?
अब राम्रोसँग जानु पनि
Thank you.
Oh, you're welcome.